A newborn baby died in Uttar Pradesh's Bareilly after the infant's mother allegedly was turned away by the district hospital. Sushma Devi, the newborn's mother, reportedly took the baby first to the district hospital, where she was turned away and referred to the women's wing of the hospital. At the women's wing, she was told that there are no beds available. Sushma Devi claims that she wasted 4 crucial hours on this, during which the infant's condition worsened and eventually she died. The Chief Medical Superintendent of the district hospital has been suspended and departmental inquiry has been initiated against the head of the women's wing.
यहाँ भर्ती करने के लिए लाए, करीब ना 3-3 घंटा हो गए यहाँ, और वहाँ डॉक्टर के पास पर्चा ले गए तो कहीं वहाँ महिला वार्ड में ले जाओ, वहाँ ले गए, वहाँ से कहीं कि जिसने पर्चा बनाया वो ही भर्ती करेगा, और फिर बाद में जब दोबारा ले गए तो बोले यहाँ बेड खाली नहीं है, यहाँ ले जाओ, इसके लिए तो इनके पास फिर आए, तो फिर उनके पास हम गए तो उन्हें भर्ती नहीं करा, बोले इसे रोल खंड ले जाओ। फिर क्या आके हम नीचे आ रहे, उतर के घर पे जाने के लिए तो नीचे हॉस्पिटल में ही खत्म होगी, नीचे भटकता 3 घंटा से ज्यादा हुई।
लापरवाही अगर समय पे इलाज मिल जाता तो
बच्चा बच जाता।
वो हॉस्पिटल में, डिस्ट्रिक्ट हॉस्पिटल में ही भर्ती होने आया था, तो हमारे यहाँ 4 कॉट पे 4 पे 8 बच्चे हैं, और उसको तुरंत कहा गया कि ये भर्ती होने डिस्ट्रिक्ट हॉस्पिटल है, तुरंत लेके जाइए आप। फिर यहाँ से भगा दिया गया दोबारा उस बच्चे को। ओपीडी का सौरभ ने लिख के भेजा, क्योंकि जो यहाँ बच्चा भर्ती होना जाता है उस पर्चे पे वो लोग कुछ नहीं लिखते हैं, सिर्फ ये बोलते हैं कि महिला ले जाओ, महिला ले जाओ, सिर्फ, और लिखा कुछ नहीं जाता है उन पे। जबकि मैंने सब जगह लेटर्स भेज दिए कि हमारे उपकरण जो है शासन को वापस हो गए हैं, सारे उपकरण हमारे जो वार्मर और फोटोथेरेपी हैं वो शासन को वापस हो गए हैं। फिर भी हम जो हमारे 4 वार्मर हैं उस पर कम से कम हमारे 8 बच्चे रहते हैं जो इनबॉर्न है, फिर भी एक आध आउटबॉर्न अगर हमारा कॉट खाली होता है तो उस समय हम उन कॉट पे ले लेते हैं कि नहीं ठीक है हमारा इस समय खाली है, हम इस बच्चे को ले लेते हैं। लेकिन कल 2 बच्चे जो है वहाँ से यहाँ से भगाए गए, जो मैंने भर्ती कराया, उधर तीसरा बच्चा भी यहाँ से भगाया गया, जिसको कि मैंने आके बैठ के इमरजेंसी में भर्ती कराया, और ईएमओ जो थे वो कल भर्ती नहीं कर रहे थे, 4-4:30 बजे की बात है। मैंने कहा नहीं सर, देखिए हमारे उपकरण आ जाएंगे, कोई ऐसी बात नहीं है, हम लोग भर्ती करना शुरू कर देंगे, हमारे पास उपकरण नहीं है।
किसकी लापरवाही है?
डेली इधर से जो है बच्चे भगाए जा रहे हैं।
Prashant Kumar bringing us this story. Let me go across to Prashant to get an understanding of what exactly this woman could have gone through. Prashant, one can only imagine the horror of it all, to be taking your sick child from running from pillar to post to get some basic medical attention. Can you share with us the story of Sushma Devi and how her infant passed away?
Well, Afrida, if you hear the story, I mean, it's completely bizarre and shocking, because this woman had taken her child to first the CMS male hospital, where she was referred to the women hospital. Now, when she went to the women hospital, there were 2 people who were fighting among themselves, not paying attention to what this lady was saying, not paying attention at all to what the condition of the child was. The child could have been very easily given treatment in the first hospital itself, the male hospital, but they referred the child to the female hospital, where these officials were fighting among themselves. So clearly, now as we speak, an action against 2 people have been taken. One, of course, the CMS of the male hospital has been suspended, and a departmental action has been started against the CMS of the female hospital. So clearly, but the fact of the matter is, you see the condition today that prevails in the UP hospitals, where they are just shrugging off responsibility. They are just turning away the patients, despite knowing the fact that today, in just neighboring state of Bihar, what is happening just because the doctors were found negligible. So clearly, I mean, they need to learn some lessons from it. Whether they learn, only the time will tell, Afrida.
Right. So I have Dr. K K Aggarwal, former IMA president, with us. Dr. Aggarwal, we have, of course, sympathies for the doctors who are overworked. We have been doing stories about their safety at workplace, but this is certainly not acceptable. When you have a critical patient in front of you, where is the sensitivity? How can you turn a patient away, saying go to some other center, when you can see that here is an infant who probably will not survive without immediate attention?
See, one thing is very clear. Whether you get a bed or not, whether you wait for your bed or not, But emergency care, once you reach an emergency center, whether you have bed or not, the first aid needs to be given. The life needs to be saved. So in every hospital, enough provision has to be there to manage triage, to manage multiple patients. So emergencies to stabilize the patient and tackle the patient in emergency is a fundamental right which every patient has. And even the Medical Council of India Ethics Regulation clearly says 2.4 that patient must not be neglected once he is admitted. So therefore, emergency treatment is a right of a patient. After that, if he doesn't get bad, that will depend upon the infrastructure facilities, for which Ayushman Bharat is now the answer for going to private hospitals and given by the government.
Right. But is it also, Dr. Aggarwal, because they are poor, they are helpless, they have to face this kind of a treatment in the hospitals? Do you think that the doctors actually, of course we understand their pressures, but then why is it that when it comes to the poor, there is a certain level of apathy?
For doctors, as far as doctors are concerned, our fundamental learning is very clear. We are not supposed to ask the financial status of a patient. There is no column in our treatment, what is your income. We don't ask and treat people according to their income, as far as the medical doctor ethics are concerned. So for us, it doesn't matter whether he is poor or rich.
Absolutely. So you're telling us about medical ethics, you're telling us about the mechanism that should ideally be there in place, but who is to ensure on the ground, sir, the situation is quite different? What you're saying is not happening in practice.
Anywhere these things are happening, that's the reason media is exposing them. Let them be exposed.
Yes.
We have no sympathy with if somebody misbehaves. Providing first aid treatment is a fundamental principle and the right of a patient.
And also the technicalities that we are given.
I cannot say about that you make them available if that is not available. Yes. I'm also not saying that treat with the two patients in one bed in a ward. But in emergency, yes, whether you have facility or not, if there is an emergency, you need to tackle that.
So that's the protocol for emergency, but are the doctors following it, sir? That is the question I want to bring in.
Individual, there are 10 lakh doctors. If somebody is not following, action should be taken. I'm talking about the rights of the patient and the duty of a doctor. My job is to provide first aid and make sure he is transferred to a safer place.
Right. So that is what the rule book says. But like you said, many a times that is not followed, as it happened in this particular case. Yogita Bayana is also with us. Yogita, when we question the authorities, we are of course given technicalities about how inborn patients are preferred over the outborn, and there are certain limitations. But where is the sensitivity? And we have things like a women's wing, for instance, that seems to be absolutely useless. It's just in the name of serving the interest of the women, doesn't seem to be helping.
This particular incident is very unfortunate, but this is not the only case. You know, if you really dig into it, thanks to you for raising and becoming the voice of such individuals. And I have personally been similar cases in Delhi where the girl was declared dead and she was running post to pillar, the newborn I'm talking about. There were no ventilators available, and this is the similar scenario. She was sent one place to another, declared dead. But luckily, one just get the helping hand and she could survive. Now she's a 4-year-old child. So, you know, this is so in our country that the lives are so cheap, and especially these people, they're underprivileged, you know. I don't blame doctors completely, but they judge, you know, whether this person has a voice or not, and that can be taken for granted. There was a fight you were telling going on, but for them, this particular case was totally ignored. So, you know, they also give priority to people, those who are waited, ultimately zeroes down to somebody who can speak for their rights, who can reach out to media. But what about so many, you know, they go unreported. There are so many children dying even today because they don't have a voice. You know, they're reach out to people like this. It's so unfortunate. There are no systems. Systems are there, as Dr. K K Aggarwal was saying, but not followed. Yes. Is not implemented, and it is also wisdom. It is of the wisdom of the doctors. If he is sensitive, so sensitivity is, as you said, is the topmost priority. If people are not sensitive, doctors are not sensitive, I think nothing can move on. Even
and those who are poor and those who are powerless, they are the worst sufferers. And like you said, of course, we try to expose, we try to take up their cases and be their voice, but there is only so much we can do. Dr. Aggarwal, I want to ask you, you were telling us about the mechanism that is in place, but what about the penalties? Is there also certain things mentioned in medical manuals where there is a failure of this nature? What action should be taken?
One thing, our basic objective of becoming a doctor is to suffer pain and suffering. And pain and suffering means acute emergency. If it is not an emergency, I have a right to even refuse treatment. I have a right to choose a patient, but not in an emergency. The basic purpose, the duty and the basic purpose for which I have become a doctor is that if I am on duty and if I am in an emergency room, I must provide comfort and suffering and relieve the pain of a patient coming back to me. And after that, after providing first aid, if I do not have a facility, my job is to refer him to an appropriate place. So so most of the hospitals, the most important thing is the emergency department. Your emergency department has to be the biggest department. It doesn't make a difference whether you have facility for bypass or other surgeries which are not an emergency surgery. But for an emergency surgery, emergency treatment, I'm not even talking about full stabilization of the patient. You need to provide the first aid. First aid is very basic. Let me give you an example in this Muzaffarpur death.
Yes.
The first aid in Muzaffarpur death involves that these children, before they are transferred to a hospital or from one hospital to another, are given either IV glucose or 1 teaspoon of sugar with 1 drop of water sublingually every 20 minutes. The first aid of a road traffic injury is, within 1 hour, stabilize the blood pressure and stop the bleeding. And that's it. Nothing more is required. In a patient with hypothermia, bring the temperature to 100 from 104 and then transfer. So what I'm trying to say is that most of the time we have standard parameters of first aid. First aid, I can understand that you don't have a ventilator and the 4 patients come, you have 1 ventilator and you don't have the facility, what to do? Now these circumstances can happen. But still, our job is to provide them whatever best is available in the available circumstances. The Clinical Establishment Act very clearly says that we provide the first aid with whatever maximum we can provide with the available circumstances and facilities. So whatever facilities you have, you provide. You can't create a helicopter and ship the patient. That's
Which is why, Dr. Aggarwal, we are saying that we should not accept excuses about patients inborn and patients coming from outside. That distinction should not be made. Like you said, the criticality of the patient's condition should be the primary concern.
No, this is a matter you as a media should take up.
Yes.
This is not only, this is all over the country. Even All India Institute and Medical Sciences, they say we will not take the antenatal cases.
Absolutely. Thanks for sharing your thoughts with us, and I hope there are authorities out there listening to your voice and taking note of how it should be ideally and where people are faltering, especially authorities and hospitals are faltering. Thanks very much, Yogita Bhayana and Dr. Aggarwal, for joining us with your views.
Times Inter